I am now pleased to introduce our esteemed guest this evening. Dr. Raja Flores is a world-renowned thoracic surgeon and professor and founding chairman of the Department of Thoracic Surgery at the Mount Sinai School of Medicine. His research has produced over 300 publications, and he has presented over 300 lectures worldwide. He is currently investigating the health effects of mold exposure on New York City Housing Authority tenants, among many other things. So, Dr. Flores, it's such a pleasure to be with you this evening, and thank you so much for taking the time.
Yep. Thanks for having me.
So, I wanted to just start maybe at a basic level, and then we can kind of increase the complexity of everything that you do and see from there. But let's start with, why do people come to see you? What is it that you're usually seeing patients for? Because I think that might be a nice segue into prevention.
So I'm a thoracic surgeon, and what a thoracic surgeon does is basically takes care of patients who have lung cancer and patients who have esophageal cancer. Those are the two biggest things. Now, sometimes it gets a little confusing. You think of cardiothoracic surgery, and that's how we're trained. But when you're finished, you either focus on the heart or focus on the cancer. And my focus is on cancer.
Got it. And so let's talk about cancer a little bit more because we've talked about some really interesting insights that you have that I feel not everybody may know about the prevention piece and the screening piece. So let's dive into that a little bit.
So that's probably the most important thing when you're dealing with cancer. How do you make sure you never get it? And how do you, I think everybody understands smoking causes cancer, but anybody with two lungs can get lung cancer. But if you really want to limit your possibility of getting lung cancer, just don't smoke. And that includes smoking cigarettes, cigars, vaping, marijuana. Anytime you burn something and you inhale it, uh, that can give you lung cancer. So the best way to avoid getting the cancer is by never doing any of the habits that put these carcinogens into your body.
Got it. That makes sense. Although there has I feel that I saw research that said there is a rise right now in non-smoking lung cancer. And so can you tell us a little bit about what you're seeing in that trend? What's causing that? How can we prevent that?
And I think the reason why you're seeing it, it may be a false rise. It's because smoking has decreased. So the numbers of non-smoking lung cancers look bigger, but it's relative to smoking. So years ago, so many of the smokers, so many of the lung cancer patients were smokers, and the non-smokers were a small portion. Now there's less smoking, so there's less lung cancer. So the proportion of non-smoking lung cancer is higher. It's about 20%. 20% of the people that get lung cancer never smoked.
Got it. Okay, and so let's talk a little bit more about the getting nitty gritty with those screenings, because I know you said there's actually a difference between the type of scan that one gets and how that can play into, prevention and you knowing as early as possible that there may be something on the lung that you should be looking out for.
So I think the main thing that you got to understand, if you're a patient and let's say you've smoked in the past, or you have a family history of lung cancer, or if you're in a high-risk profession like a firefighter that's always inhaling smoke, the people down who were exposed to 9/11, because it's not just smoking, but asbestos and other things that can cause cancer. If you are at an increased risk, what can you do to make sure that you never get it, but God forbid if you do get it, that you can be cured? And it's a very curable cancer when caught early. When you look at the internet, you'll see so many things you think like, oh my God, lung cancer is a death sentence, but it is not. The important thing is to catch it early. And when you screen for it, as opposed to breast cancer, where you can palpate and you can get mammograms, prostate cancer, they're getting PSAs and screening that way. Colon cancer, they do endoscopies to make sure that they get it early. But really, in the old days, there was nothing for lung cancer. You'd get an x ray, but it was a little too late by the time you identified it. So several years ago, this study came up where they looked at CT screening, CAT scan screening for lung cancer, and it's a low dose scan because many people are always worried, is it too much radiation? It's the same radiation as a mammogram. So if you are at risk, you can get a low dose CAT scan as a screening scan to see if you have an early lung cancer. And if you do have an early lung cancer, it's very, very curable with surgery. We make three little small holes in the chest and we take out a little piece of lung. So it is something that if you're at risk or your family members, mom and dad were smoking for many years and they have this cough and you're worried about them, getting a low dose screen can save their lives.
I feel like that's a huge takeaway that CAT scan is the way to go. And do you advise that just with smoking in the history, or do you suggest kind of should there be symptoms? I'm not curious what that conversation is like in the physician's office. If there's sometimes pushback on like, well, you don't really have any symptoms, so there's really no point in getting the scan.
So that's an important point, and I may have confused it a little bit. When you're screening, it means you're at a high risk, but you don't have symptoms. If you have a symptom, like a cough or spitting up some blood, you are no longer screened. You have a symptom and you need to get a scan. But if you are concerned, you want to practice preventative medicine and you want to be on top of things, that's when you'll get a screening CAT scan. So when I see a patient in the office, when you look at the studies were on smokers. But we know family history is a big deal, exposure to asbestos is a big deal, even more so than smoking itself. So you want to make sure that if a patient has that risk factor, they have a discussion with their doctor about getting screened, about getting this CAT scan, not an X-ray, a CAT scan.
Got it. And let's shift and talk a little bit about our environment and lung health, because I feel like this is something that we maybe take for granted sometimes, right? We're living our lives, and we mentioned at the beginning, part of your portfolio is you're working on asbestos research. And so tell us a little bit about what you're seeing out there in the field and maybe what our audience members could take away from this talk to maybe practice in their own lives, whether it's, doing a little investigating of their own on where they live.
So asbestos is a silent killer. Everybody knows asbestos causes cancer. When you look at the commercials and you hear 1010 Wins News, you hear about this cancer called mesothelioma. And that's what asbestos causes. And it's known to be a deadly cancer. Now, not everybody who gets it is going to die, but you'd think differently when you look at the internet. And we just put out a study showing our results with that. So that's going to be coming out soon. But the number one thing that asbestos causes is actually run-of-the-mill lung cancer, more than mesothelioma. Mesothelioma, there's only about 3,000 cases a year. Lung cancer, there's about 235,000 cases a year. So it's a big difference. But the reason why mesothelioma gets so much attention is because of the financial gains in these big class action lawsuits that are taking place. So it's frequently the lawyers that'll shine a spotlight on mesothelioma, but it's really lung cancer that you're trying to find early and cure. So let's say the World Trade Center, if you were down there cleaning up or you lived anywhere down near the World Trade Center during 9/11, you're at a high risk of getting a cancer. And that's where a low dose CAT scan can really save your life.
Got it. All right, so I'm just gathering my thoughts here because there's so many different directions that we should go. Well, and actually, I want to wrap up lung cancer a little bit because I'm sure there's more to talk about here. So, are there any specific early signs of lung cancer specifically that folks should be on the lookout for or just be aware of?
So usually when you have a symptom from lung cancer, it means that it's more advanced, which is why you want to catch it early with a screening CAT scan. And many of the lung cancers identified nowadays are not really from screening, but what we call backdoor early detection, where you get a scan for one thing, let's say to look at your heart and calcifications, and next thing you know, you see a little nodule there, an early lung cancer. So, um, so for lung cancer, uh, if you have a symptom like coughing up blood, it usually means it's not in stage one where it's curable. It could still be curable. Some patients have been cured where they've had this pain in the back, and then you get a CAT scan and you see that there's a cancer eroding through their ribs. Now, you can remove the ribs. We can remove 3, 4, 5 ribs, even more, if there's a cancer eroding it, and then you reconstruct it. We've identified cancers that are not early by screening where we've had to remove the entire lung. And people are surprised. Wow, you can live with just one lung? Yeah, John Wayne had it. The Pope has one lung. That's why he was so sick. So there's a lot of myths out there as far as, you know, you being a dead duck if you get lung cancer. And that is absolutely not true.
That's so interesting about the living with one lung. And you tell me if this is going too far out of your territory, but can we chat about pulmonary fibrosis for a minute? Because when I think about like living with one lung, I know pulmonary fibrosis, like that scarring, typically non-reversible. Are we seeing any advancements in treatments there when it comes to either surgery or medicine?
So, pulmonary fibrosis, we feel it's usually from an environmental exposure that's giving you this fibrosis, causing a reaction in your body to cause your autoimmune system to basically attack the lungs and cause this fibrosis and scarring. But you got to remember, it happens to both lungs. And usually, if you're a pulmonary fibrotic patient, your breathing tests are not great. And if you develop a cancer in there, you can't really remove the lung if your breathing tests are bad. So then you have to go for a substandard therapy, not surgery, but something else, whether it's chemo or radiation, that doesn't lead to a cure. Now, with pulmonary fibrosis, usually it can sometimes get to the point where you need a lung transplant. So that's a different sort of area away from the cancer thing. But people with pulmonary fibrosis, when they progress and they haven't developed a cancer, they can get a transplant. But when they develop a cancer, number one, you can't get a transplant when you have cancer because you go on immunosuppressive medication and that lets the cancer just explode. But if you have decent lung function and you develop a cancer in there, you can take out as much as the entire lung. You can do a lobectomy where you take out either half or a third of the lung. You can do a small piece of pie shape resection, which is called a wedge resection or a segmentectomy. So there are many different things we can do, but you want to try and get it before you're coughing up that blood, before you're getting that back pain. And that's where the screening comes into play.
Yeah, no, that makes a lot of sense. Okay, so staying with t toxicity a little bit, are there any ways that we can detox our lungs from smoke or pollution? Anything that we can do?
Yeah, that's a big thing. People are always asking me, especially after they have cancer, but also before, what can they do to prevent getting cancer or to make sure that they're better? What can they eat? What can they do? And there's not a lot you can do as far as food is concerned, other than just eat healthy, right? Antioxidants, blueberries and stuff. I tell them I like green tea and all of that. But I'll tell you, the number one thing you can do for your health with or without cancer is exercise. When you're exercising and you're really making those lungs huff and puff and you're working your diaphragm and your intercostal muscles, those are all helping to pull those lungs open and get oxygenated blood down into the distant part of those lungs. Because if you don't do that, and the lungs are contracted, then that part of the lung, the outside, you allow anaerobic oxygen, bugs that don't need oxygen to grow. That's how you get pneumonias, that's how you get infections. And I'm convinced those are the precursors that help you to develop a cancer down the line. So, eating right and exercise, which everybody takes for granted, that's pivotal to make sure that number one, you don't get cancer, and number two, that you maintain that lung function. So God forbid, if you do develop pulmonary fibrosis, you have a huge amount of lung reserve there.
Yeah, I mean, I'm sure it may be placebo effect, but I know for me, just like getting out into nature and getting a big breath, of fresh air really feels like it does something for
Yeah,
detoxing, especially if you're living in the city.
I know there's nothing placebo about it. That's real. That's,
Yeah, yeah.
and especially in New York, I grew up in this city, and I remember back in the 80s, every place had smoke. You go to a restaurant, you go to a bar, there's smoke all over the place. People were smoking in the subways. I mean, I guess they still do, but not supposed to.
Well, speaking of, you actually read my mind because a lot of people out there say that vaping is the healthier thing to do when, put against smoking. So, love to put that out there for you to maybe debunk the myth if you'd like.
That's a tough thing because vaping has really permeated this younger generation, Generation Z. They have really felt the effects of vaping, where people have died from their lung reacting to the substances in it. Essentially, vaping, you're heating this vapor to 400 degrees and then you're inhaling it. So there's a physical injury that's going on. In addition, there are carcinogens in it, cancer causing particles in that vape. There's something called polycyclic aromatic hydrocarbons. Yes, it's a mouthful. And that mouthful causes cancer. And so it's in vaping, it's in marijuana, it's in cigarettes, it's not in all these things. And you got to remember that it took 50 years to prove that smoking caused lung cancer because it's political. There's a lot of money involved. Big tobacco doesn't want it out there because then they're liable, right? And vaping, especially not just nicotine, but marijuana, all that, that's big tobacco and cigarettes reincarnated. So you're not going to have, uh, you're not going to be able to prove it for another 50 years,
Right.
right? So it just takes common sense now. If the same thing coming out of that causes cancer from cigarettes and the same thing you're inhaling from these things, that's got to cause cancer. Do we have to wait 50 years from now to see our kids suffering from it to be able to say, yes, it causes cancer? You know, when there's big money and politics involved, all that stuff gets distorted and it's not in our favor.
Yeah. I hope that the messaging, I'm sure there is messaging out there right now on it, just, really trying to turn that story around. But it's so important to understand. I think what you mentioned about like the heating and the same chemical, I mean, that's information that these anybody who's vaping should know. You're not really doing yourself any favors.
But you got to realize with every year that the ill effects get postponed, meaning the transmission of the ill effects to the public, that's more money in their pocket, billions and billions of dollars. So it's in their interest to postpone anything. An extra year is billions of dollars. So they want to keep kicking the can down the road. And it's up to us, especially as parents, to keep an eye on it and to talk to your kids about it. But kids are going to do what they want to do, and unfortunately, you get these flavored vapes, you get all these other things. They're targeting the kids. They're going to say there's no way to prove that. No, we just want to do this because it's enjoyable. No.
Yeah, and I mean, I think that's one of the positive effects. We run robust athletic programming, and being part of an athletic environment, usually you're a little more inclined to not want to do something that's going to harm your lung health because it's so kind of tangible, right? If you do something that's the night before that, like, you're not going to feel good when you're going out to run a race or swim in a competitive swim meet after. So I'm sure we have some folks out there that are interested in increasing their own lung capacity. Do you have any recommendations on those who may be healthy individuals who are just saying, I'd like to know what I could do to increase my lung capacity?
So exercise is a big deal. Running can be hard on your joints. The best lungs that I have ever operated on are swimmers. I
Mm.
guess whatever they're doing with holding their breath and really pushing it swimming wise, those lungs, I've taken out half of lungs and then you repeat the breathing test. It's like they never had anything removed. So swimming is the number one thing if you want to build up your lungs to do, but also running or anything aerobic is good for you.
Fantastic. I was actually going to ask you about that. If individuals you had seen that had part of their lung removed, if they kind of adapted and could go back to performing what they were doing prior. So it sounds like that's a yes.
Oh yeah, I've had people after a lobectomy run marathons.
Wow.
Now, you've got to make sure that those patients, because you got to remember, many of them are smokers, so their lungs have gotten injured. Now, there are some, especially the 20% who are never smokers, who have good lungs, but they developed a cancer. So those are the ones that can run marathons and do everything afterwards. But if you're a smoker and you've really injured your lungs and you've developed a cancer, you may not be able to run a marathon, but they're not running a marathon anyway.
Right, right, right. So we have somebody that's asking, I'm just going to jump in with a few questions because they're relevant to what we're talking about. So what role would secondhand smoke exposure over a few years play in developing non-smoking lung cancer? Should someone that had that sort of exposure be getting regular screenings as well if there are no other risk factors? It's a great question.
So that's very real. You know, they like to play down the secondhand smoke component to it, but I do believe a lot of these never smokers were exposed to secondhand smoke. There's a study going on at Mount Sinai looking at flight attendants from the old days because they allowed smoking on airplanes, not all over the airplane, just in the back, right? As if that's going to keep it in the back. It goes throughout
Right.
the whole plane. And so there are studies looking at these flight attendants who develop lung cancer. So secondhand smoke is a real thing. In hotels, they banned it. In New York City housing, they banned it, but people still do it. But someone is taking away, it's impinging on your rights if someone is blowing secondhand smoke in your face. The other thing that many people don't realize, there's something called third hand smoke. What is third hand smoke? So that is when you're smoking in a room and you leave and the smoke settles. And then next thing you know, the room heats up, whether summer's here or heat. And then next thing you know, those particles go back in the air again. And then you inhale it. So that's third hand smoke. And that's why you can't smoke in hotel rooms. It's because of third hand smoke. So there are many things out there that can get you. And just smoking is such an obvious thing. Now, you got to realize if you're addicted to nicotine, you can't just will that away. That's a real addiction. That's like alcohol. That's like opioids. That's a real addiction. So you got to understand that. If you have a smoking addiction or a nicotine addiction, you need a support system. You cannot just will it away. It's almost impossible.
Right.
So you can't get mad at your parents if they're still smoking after 40 years. Can you just quit? No, you got to put a real support system in place.
Now, so to go, that's really fascinating about the third hand smoke. I had never heard about that. So to go back to the question, if someone has been exposed though to that second hand, so you would suggest that that would be strong enough to go to their physician and say, I just feel that I should be advocating to get screened.
So you should have a discussion with your physician. You've got to realize there's always pluses and minuses to every individual person situation. And the recommendations are guidelines. And the guidelines are based on certain studies. These studies did not include secondhand smoke, but common sense ain't too common, like Yogi Berra said. But if you do have a risk factor, talk to your doctor. And if you think, it's keeping you up at night, you can't stop thinking about it, then you should get a low dose screen. It takes a minute to get the scan. You don't need contrast. You're in and out. And like I said, the radiation is extremely low. It's the same as a mammogram.
Yeah, yeah, no, thank you. Okay, and then someone else is asking about indoor pollutants, just like dust and other factors, maybe like a little less toxic than asbestos.
Yeah, so there's a lot of things that we inhale. There's dust mites. In New York and the poor areas, high incidence of asthma. Many of these are from, these pollutants in the air. Many near, let's say, like the Cross Bronx or the FDR. That car exhaust is going into their homes. So high incidence of asthma. So there's a lot of reasons why people can develop lung cancer from inhaling these pollutants. In the old days, the leaded gasoline, that caused cancer. That's why they got the lead out. And so it's there's so much of this stuff surrounding us. I don't believe getting cancer is bad luck. I believe it's incited by something. If you got cancer, something caused that. You may not be able to find what caused it, but something triggered a genetic mutation in your body for you to get that cancer.
Yeah. Well, with that, maybe let's shift to COVID and talk a little bit about the impact, sort of the long-lasting lung impact that COVID has had on individuals. Maybe that, I mean, I know you were right in the thick of it, treating, as COVID as the pandemic started. What were you seeing then, and what do you see now in the aftermath of that?
Yeah, I mean, COVID really changed our lives. The physicians in the front lines, when that first wave came, the hospital, you'd come into the hospital every day and a new floor was taken over uh, by COVID patients. And we had to stop operating on elective cases. We had 80 patients in ventilators in tents in Central Park. That tells you the entire hospital was flooded. Trucks of dead bodies. It was unreal. And we're thoracic surgeons. So my team was in charge of doing the tracheostomies where you make a cut here to put the breathing machine over here through their throat. And so that gives you a huge burst of virus. And, I had COVID a bunch of times. And it was very scary. We had our guy Eddie from the cafeteria died of COVID. My scrub tech died of COVID. So it brings back a scary time. But we got through it. Some people did die that were our colleagues. But nowadays, COVID, I think all the people that were going to get sick and die from COVID died. There are people now who get COVID and, it's like a cold. Uh, we just recently published a study a couple weeks ago where we found that people who had a history of COVID, who then developed lung cancer and needed surgery unrelated to getting the COVID, smokers, had a higher complication rate after surgery. So there's still these effects of COVID that are going on. The saddest thing I saw with COVID as we were going through it is the politicization of COVID. It just got politics got involved, and there was a lot of misinformation flying around. And that was the saddest part of this because there's real medicine that's going on with it to try and help people. And it was sad to see politicians sort of use this as a political football to advance their own agenda.
Yeah. So it sounds like you're not necessarily seeing long-lasting lung i- issues arising from like a healthy individual who maybe has gone through COVID a few times, you being one of them.
What's interesting is I'm seeing a lot of patients who have findings on their CAT scan or x-rays where people are concerned, is this a cancer? But no, it's COVID. They
Oh,
had COVID, it caused scarring. They think, could it be a cancer? And sometimes we have to biopsy it with a needle. Uh, so there are long-term effects that affect me as a thoracic surgeon, uh, where I am seeing patients who need more of a workup because they had COVID. And then, like I said, if they need surgery for lung cancer, their lungs were injured. If uh, And some of these patients, are already sick to begin with, and many of them COPD, emphysema. When they get COVID, they get pretty sick. We're
Yeah.
not seeing deaths anymore like we saw before. Before, every day, you had people dying left and right, and you had ventilators where you had 2 to 4 patients using the same ventilator, and it was interesting when I look back and I see patients on those ventilators. Right, we're in New York City, and there's a microcosm of people there. And I remember one time on this one ventilator, um, there was a Hasidic man, a Jamaican man, an Asian woman, and uh, just some other white, looked Irish, basically, all on this same, living and breathing through this same circuit. And, if it weren't for patient thing, that would be the photo to describe New York City. But, of course, you can't take a picture of the patients and post it.
Yeah, no, of course. But you mentioned the COPD. Has the medical community found that COVID triggers anything in that lung disease world? I mean, I know that it can short term, of course, but like have you seen COVID like trigger anything else? Could that be the cause of something like, like a pulmonary fibrosis or like asthma? I'm just curious what you've seen.
Um, I'm sure there are reports of it. In my practice, I wouldn't see that. I usually see them when they've developed a cancer, but I'm sure there's got to be some kind of interaction like that.
Yeah. So we have somebody asking, do you need a physician referral to get screened, and does Mount Sinai specifically provide these screenings?
So there's a bunch of different things you can do. We have, first of all, you can call my office, and you need a scan. I'll have to talk to you, and then we can get a scan. We also have a lung screening program here at Mount Sinai, led by Claudia Henschke. Um, what you got to realize is that screening is not just one CAT scan. You start with a baseline CAT scan, but screening is done once a year. You want to catch a cancer as it's changing, as it's moving. Most of the screens will not show a cancer, and sometimes it can show abnormalities, and then you follow the patient. So it's every year you get a CAT scan and you look for patterns, and then you remove something. So it's not a one-time thing. It's a lifelong thing. That's why you want to make sure that you have the risk factors for to develop a cancer. So you want to make sure that that is what initiates the screening process, and that it's not just a one-time thing.
Got it. Okay. Wow. Just like so much good content that you're giving us. I'm trying to keep up with it all. Okay. So we have a few more questions coming in, pertaining to COVID specifically, because we were just talking about that. Oh,
Um,
go ahead.
Tara, let me just make sure to this, I think, is an important point
Yeah.
for patients who are interested. When you get that baseline screening, you're going to find some abnormalities, right? It's like, looking at your skin, you've got, a spot here, a spot there. The same thing is in your lungs. You want to make sure you're not going to somebody with a quick trigger finger who right away is going to say, oh, this is abnormal, let's cut it out. You want to go somewhere where they have a lot of experience, where they can say, okay, there's a little something there. Let's just follow it. Let's just get a CAT scan. You don't want someone that's going to have a quick trigger finger. And what you got to realize, there are 2 types of cancers. There are turtles that kind of sit there and don't do much, like prostate cancer. A lot of those are just indolent, slow growing. And then you got the rabbits that are going to develop quickly and start to jump and spread throughout your whole body. And the rabbits are the ones you want to find. And how do you find the rabbits? It's when you get another scan, you see, wow, it doubled in size. That's when you take it out, because it usually takes a few years before it starts to spread. So you have time if you have an abnormality.
Okay. I guess my other question about the CAT scan, you mentioned something about COVID and scarring. Is that something that if someone saw, oh, I did have some sort of scarring that developed, would that be a cause to keep an eye on that year over year if they were healthy?
Absolutely. So
Okay.
if there is a scarring there, you want to get another scan in a year. Make sure it's not something else, right? Because it may look like a scar, but how do you know it's not a cancer in development? So you keep an eye on those things.
Got it. Okay, interesting. Okay, so going back to COVID, will there be new variants included in this spring's vaccine, if you know about that, that is being promoted to patients over the age of 65?
I don't know much about that. When I do have older patients, patients who have risk factors, lung cancer patients, I do advise them to get the COVID vaccine. Um, so I think it's an important thing, especially if you're older. If you're younger, I don't feel strongly about it, but when you're older and you have comorbidities, I think it's very important.
Yeah. Feels like unfortunately there's going to be new variants popping up, although they all seem to be a little bit milder than that original.
Yep.
Yeah. So we have somebody joining us who, again, wants to thank you for learning about the third hand smoke exposure. And they are a lung cancer survivor themselves with a lobectomy, no prior tobacco exposure. And they're wondering, do you know of any research studies that are looking to detect lung cancer, maybe such as like blood biopsies or something of that sort?
So there are these things called liquid biopsies. They're not really ready for prime time yet. There's a lot of stuff. What you got to realize in medicine that is cutting edge, that's not necessarily the best thing for you. People keep trying to look for things and improve medicine, and medicine's getting more and more expensive. Yet we know it's not getting, uh, it's not having the effect on the population that we want. We want people to live longer with less disease. But despite medicine skyrocketing costs, we're not going in that direction. So, what you want to make sure is that whenever you have this new study, this cutting edge type stuff, that you research it very well. Right now, the only way you can find a lung cancer early is with the CAT scan. The blood, not working. Other stuff, sputum, blood test, it's just not doing what we need it to do. So the basics right now, a low dose CAT scan, that's what you should get.
Got it. Dr. Flores, what have we not covered when it comes to lung cancer specifically that you want to make sure that our audience knows?
It's not that complicated. If you have a risk factor and you get a CAT scan, you can catch it early when it's curable. In the old days, once you started having symptoms and they had to cut your chest open from beginning to end, take out a rib, it was extremely painful. Nowadays, you can do a couple little small holes and get this thing out, but that's only if you catch it early. So that's the best thing to do is to make sure if you do have a risk factor that you get this low dose CAT scan. It's not that complicated. And as opposed to the other things, like a colonoscopy, you have to have something placed in your body. These biopsies where you're going with needles, and this is just a quick X-ray, basically.
What about, I mean, there's just been so many wildfires the past few years. Is that something for folks that, maybe right in an immediate area where the wind would take the smoke that way? Is that something that people should be considering when you think about that secondhand smoke?
Yeah, I believe so. It's a hard thing to study because they come and then they go. But like I said, you got to look at what's the substance in there, what's being burnt, what are you inhaling? If it's a cancer causing thing, a carcinogen, you're at risk. So I do believe that if you're caught or your occupation has to deal with the wildfires, you're a fireman, yeah, you got to get screened. I've got so many firemen who are patients, not just with lung cancer, but with esophageal cancer and mesothelioma as well. So that's an important point.
Yeah. Well, you touched upon this a little bit with your green tea recommendation, but do you have any vitamin or any other food recommendations for our audience here that they could take away with them if they're just working on preventative lung health care?
Yeah, I think just eating a balanced diet. I always make sure I have a protein, I have a green thing, and I have some kind of starch. I do take a vitamin a day. I don't know whether it's doing much or not. My wife shoves vitamin D down my throat every morning. I think there's
This time of year, vitamin, yeah, it is really essential.
just a healthy lifestyle, but exercise, I do believe exercise. Now, I have no proof of this, but I do believe when you exercise, your body releases things that says you're running around, you're hunting, you're alive, and I do believe it releases things that keeps cancer at bay because we're always forming cancers in our own body, and our body kills it. And that's sort of the latest thing that's coming out now, this immunotherapy and stuff like that, where you're getting your own body to kill these cancers. And I believe you can do that without, by having a healthy lifestyle and exercising.
Yeah. And I was also going to ask about for like lung diseases. I know that energy can sometimes be hard for people to cope with. But I feel like that exercise, it also plays into the energy. It actually can increase one's energy.
Oh, that's
I was going to ask if you have any other tips for individuals that may have kind of a lower energy level, which I think does tie into what you were talking about with not getting enough oxygen into the lungs that can actually cause you to feel a little bit more sleepy.
Yeah, no, I mean, when I'm feeling low energy, and as a surgeon, you can't have low energy. As a surgeon, you got to have high energy and you got to be ready to, do things. When I feel low energy and I'm kind of tired, I go hit the bag. And after I hit the bag a few times, I'm feeling good.
Yeah. Yeah. Well, I'm just going to remind the audience we still have time for questions. We had some good ones roll in, but if there's any others, please feel free to chime into the chat. Um, Any other advancements out there that we should know about, whether it's like specifically with lung cancer or, peripheral sort of lung disease? I know that's not necessarily the area that you're practicing in, but anything you might have heard about that our audience may be interested in, might want to go do a little of their own research on.
I think, one of the biggest things that's coming out in medicine, and I touched about it before, is this immunotherapy. And you got to make sure that whenever there's a new treatment out there, you have to be a little skeptical, because things come down the line and it wants to get disseminated right away. It's important to be very critical. Like I remember in the old days when laser came out, everyone would come to me, "Oh, can you do this with the laser?" Like they get so focused on this thing. What you want to do is go to someone that has a lot of experience. So you want to be careful about getting swayed by technology, by advancements. In the end, we have the same body we had thousands of years ago. And most of the groundbreaking stuff has been discovered already. So always be very skeptical about new things. It may not always do what it's supposed to do, but it's making a lot of money for somebody. So always make sure, go to a doc that you trust and say, "Hey, what's the real deal with this?"
Yeah. Yeah, and it's like you said with, with the vaping, that it might not be until 50 years later that the real research comes out about it, and then, they pivot. And I think
Yeah.
the people that started selling cigarettes pivoted into the Lunchables for kids, and, and then that became a whole, what are our kids eating? So there's a lot there. Well, because you mentioned advancements, though, I wanted to touch upon AI. I know that Mount Sinai is certainly is partnering with AI in ways that are possible. Are you seeing any of that in your department or, within lung cancer
Yeah,
treatment?
I mean, I think that is something that has piqued a lot of our curiosity is AI. How is that going to help us take better care of patients? In surgery, it's a little difficult because, are you ready to trust this artificial intelligence with somebody when they're on the table? I think That's down the line. That's not something that we're close to. But when you look at radiology, like let's say screening for lung cancer, if in AI you can capture all the minds in the United States, thousands of radiologists and their experience, and then you throw it into AI, my God, you would do fantastic, not just in identifying cancer, but making sure to know when it's not cancer, where you don't have to intervene in the patient. So I think for radiology, AI is the future. And then you've got pathology where you biopsy it and you look at it under the microscope. So you have all these slides with cancers and normal tissue where you throw it into a program that has thousands and thousands of brain power that's been recorded in there from experts. That's just going to be better than any one individual can do. Now, that being said, you got to have a human being that's looking at it at the end. Like right now, you put something in a chat GPT, next thing you know, it'll spit out a publication. And we found out those publications don't even exist. So you've got to make sure trust but verify. So when it comes to AI, sky's the limit, but you got to verify it, especially when lives are on the line.
Yeah, no, absolutely. It's definitely an exciting time, though. You're right. There's going to be lot of good that can come from it. As we're winding down, and I re recognize you may not have an answer to this, but let's talk about breathing techniques. Is there anything that you've seen in your practice and your experience, as far as breathing techniques or exercises that folks can do to whether it is calming down or again increasing that lung capacity?
So there is, and we do it after surgery. So after surgery, you may see that people have this little contraption where it has a little ball, and it has a tube. You got to suck on it and make the ball go up. What does that do? That increases the amount of oxygen to the end part of your lungs, to the deepest part of your lungs. Like I said, when you don't take deep breaths, when you don't exercise and really huff and puff, those outer parts of your lung kind of collapse. It's called atelectasis. When it collapses, you don't get a lot of oxygen in there. When you don't get a lot of oxygen in there, the anaerobic bacteria will multiply. The anaerobic bacteria, what you have in your teeth, if you pick your teeth or you're doing something or you go to the dentist's office and it really smells bad, that's anaerobic bacteria. And that's what you don't want growing in your lungs. So when you breathe that thing and you really expand those lungs, it prevents that. So when people are post-surgery, where they have pain, we still make them take those deep breaths so they don't get that bacteria multiplying in there. And so that's a very important thing that you can do if you're sedentary, you got a broken hip, knee, and you want to make sure you're not getting pneumonia. You can get this thing. It's called uh, uh, incentive spirometry. And that's where you suck on this thing and it inflates your lungs.
Thank you for that. We'll make sure we put that in the post-event communication as well, so everyone has that. We had another great question coming in about, do you have an opinion on indoor air filters? Do you think they're worthwhile?
I do. I do. I got one right here in my office. I do. I think they are worthwhile. Uh, I don't have any proof for it. I don't know of any proof, but we use filters for water. We use filters for a lot of things. And when you realize that not many people, when you're in a big corporate environment, not many people are going to care about the air you're breathing. We saw it with asbestos companies. You got to protect yourself. And a filter is just one more level of protection.
Yeah, absolutely. What about humidifiers?
If you have reactive airways, sometimes that can help prevent reaction. It helps with people who have little kids. If you have croup or something like that, those humidifiers can really help.
Okay. Any other questions, audience? You've just been knocking them out one by one. This is amazing. Um, I mean, I feel like we tackled AI. Is there, and sorry, just to go back to I think you said the incentive spirometry.
Mhm.
Yeah. Is that something that like anybody, I know you kind of said post surgery, folks may get that, but are you kind of suggesting that and a healthy individual who's looking to increase their lung capacity that they could benefit from that as well?
No, if you're a healthy individual, go out and exercise.
Got it.
If you got grandma who just broke her hip, she's sitting at home, go to a medical store, a medical device store. It's a little plastic thing, but it'll help prevent grandma from getting a pneumonia.
Got it. Got it. That makes sense. And that's swimming. We'll take note of that. Swimming is the way to
Go
go.
to the 92nd Street Y pool.
Yes, go to our
Oh,
pool.
that's-
Get a lesson. So I see. Don't be like me. I know how to swim, but I can't hold my breath, and that's probably where the lung capacity comes in.
yeah, I cannot work out swimming. Some people can work out swimming. If you can, that is the best thing for your lungs.
Yeah. So let's just look to the future a little bit more. What is your hope for your field, for your focus of, lung health and prevention, which is what we're kind of all about at Spark Your Health, is hopefully preventing things. What's your hope to see, over the next 10, 20 years? What do you hope to see develop other than hopefully research that comes out about vaping, I
Mm.
don't hope that it's not good research, but I hope that if the research does come out proving it's not good, that we're getting that information into the light where it should be.
Yeah, I think from the prevention standpoint, I think people already know don't smoke, the vaping thing, it's tough to convince teenagers. What I'd really like to see is the early detection part because people are going to develop these cancers. And what I don't like is when I have to do a big, complicated operation for something that if they would have caught it 2 years or 3 years earlier, they'd have a couple little holes and they'd have all their lung function. I don't like when I have to go in there and do these big, crazy operations where I'm cutting out part of the lung, part of the covering of the heart, the diaphragm, the ribs. You don't want that. You don't want to wait till you have symptoms. So if you catch it when it's this big, your surgery is this big. When it's that big, your surgery is that big.
Yes, no, that makes sense. All right, well, it looks like our questions have wrapped. I'll wait for another second and just in case we have any others coming through. But I think you gave some amazing pointers today. We will make sure that all of this gets into the post-event communication. We do have one more coming in saying, is there an age that is considered too young for lung screening? Which is an interesting question considering the secondhand smoke question.
That is a very good question. I've had lung cancers that I've removed from 24-year-olds, 20-year-olds. I've had mesothelioma in teenagers. So you're never too young to get cancer. Should you get screened? Only if you have a real risk factor. Um, so you're not going to catch all of them unless you screen them, but there's a risk benefit with everything that you do. So usually a healthy young patient, no. A young patient whose mom and dad died of lung cancer, who was exposed to secondhand smoke, who works as a firefighter, who was down on 9/11, I'd screen those. So you can't really generalize. You got to make sure if you're worried about it, talk to a healthcare professional who is familiar with screening so they can give you the pluses and minuses.
Yeah. Well, and just as we start to oh, hold on. I might have had more questions just come in. Let me just double check here. So I'd rather ask their questions than okay. Yes, we have a few more quick ones. So have this is maybe for you or for Mount Sinai in general. Do you do volume reduction surgeries for hyperinflated lungs?
You do, but we do, but it's very selective. You have to have a pattern on your scan that shows that you would benefit from it. So basically, what you're doing is you're taking bad lung that can't bring oxygen into your blood, but that bad lung is pushing on the good lung. And if you get rid of that, it allows the good lung to expand and have more function. Not everybody's pattern on their scan looks like that, so it's very individualized. But yes, we do that.
And what I want to end on is maybe just really basic, but sometimes it's nice to bring it back to the basics. So I did a Spark Your Health talk probably a year ago with a woman who wrote a book on posture. And one of the things that she talked about was that actually your lifespan can be somewhat dictated by your posture because, and it comes back to lung health, because if you're hunched forwards all the time, you're not getting that sort of like amount of oxygen into your lungs, into your blood that you should. So just curious if you have any thoughts on that, any parting words on if that makes sense tying together.
100%, 100%. When you have good posture, you're like this, and you have air coming into all parts of your lung. When you're hunched like that, this back part gets collapsed, atelectasis. There's something called rounded atelectasis that we see, and it's very much in patients who have scoliosis, who are very hunched. And it is that area that doesn't get oxygen in there. And little by little, those lungs start to collapse. And then what happens? You get the multiplication of the anaerobic bacteria, which then gives you a pneumonia. And that's hard because now you have these bugs growing in there and you can't get oxygen in it because it's been collapsed for so long. So posture, very important.
I love it. Well, I think that's a positive note to end on. Dr. Flores, thank you so much for everything that you do for the community. And thank you for taking the time with us this evening. And I will just tell our Spark Your Health community if you have any follow-up questions, you're welcome to shoot them over to sparkyourhealth at 92ny.org. We'll make sure there's a post-event communication that goes out. And again, we thank you for taking the time this evening. All good preventative things for us to know.
Yeah, no, thank you for having me. I love getting the word out there. Anyone has questions, they can email me too. I'm very accessible.
Yeah, we'll make sure that all of that information is in the post-event communication, so they have the ability to reach out to you.
Thank you.
All right, thank you everyone. Have a great evening. Stay well.